Okay, part two of probably 10 parts. So where I left off was we had finally gotten the chest x-ray, we got the ultrasound, and the resident has called me back to talk about it. He has already given Chayse the results, which were that he had a large pneumothorax. So basically, part of his right lung had collapsed, and I will say I've seen quite a few of those in my day, and it was one of the most impressive that I've seen. Their diagnostics are as good as ours, if not better. And the doctor was very kind, and Chayse had told him that I had medical background and medical credentialing, and so as a nurse he was happy to show me all of the diagnostics, and I was very thankful for that. But they determined that the best course of action for him would be to actually do a fairly extensive procedure and go in and of course decompress the air, and I was pretty sure there was some blood involved just from the way it looked. We didn't really talk about it too much, but the idea of just opening or doing a thoracostomy and inserting a chest tube to release the air was not the option for him. It was to go in and actually address the apex of the lung or part of the lung. Basically, you go in and you remove a little section, you allow the chest wall and the pleura to kind of stick together, and essentially, for the most part, on the right side, once you do that procedure, you should eliminate the risk of having another pneumothorax in the future or a collapsed lung. So, so that was what they decided for him. And because he was not in acute distress, the decision was made for that to be handled the following day, which is today, which is Friday. So, Chayse was kind of in shock. I asked lots of questions. I wanted to know the process, the procedure, just to see if it was similar to, I'm very familiar with how we would treat that in the U.S. So I wanted to see if it was similar. It was. They walked me through step by step. And again, we were dealing with broken English. I did ask a couple of times about, a liaison or someone that could kind of help bridge the gap. We didn't get anywhere with that, but they were kind of treating him like an emergency patient, as well they should have, but kind of not. It was very interesting. The whole process from that point forward, really from the beginning, was interesting, but from that point forward, it was really interesting. So, we had been in the waiting room in the ER, back to the back to do blood work. Then they don't keep you back there in a bay or in a room or on a bed or in a stretcher in the hall. They put you back into the waiting room with all the sick people. Then and this was for injury people, all sorts of people, we saw the same process. Then back to get a chest x-ray, then back to the waiting room to wait for results, then back to finally get results that told us we were going to have surgery. You would have thought that he would have stayed out there at that point. So, next thing to happen, we were then taken upstairs. We were escorted upstairs. We were trying to piece together and understand. We thought that they were saying he was going to be, because I did ask specifically, is he going to be admitted? I did not want to take him home. And they agreed he needed to be admitted, so everybody was on the same page there. So we assumed that's what we were doing upstairs, is being admitted. We went to another waiting room, lots of waiting rooms in this story. We sat in the waiting room, and no one spoke English at the desk that we went by. The two employees of the hospital communicated in German to each other what he was there for, whatever. We went into the waiting room, which is just kind of in the hall. The whole idea of privacy pretty much doesn't exist. So we were in this hall with other patients. One I know is probably a cancer patient, very much looked like a cancer patient undergoing treatment. There was a pregnant lady there and her husband. And then another pregnant couple walked out or around the corner. So anyway, we were there for probably 30, 45 minutes. Then a gentleman came, again, broken English. He had a different color scrubs on. He came and got us and took us into this little office area and started asking what I determined was pre-anesthesia questions. So asking a lot of questions about, have you ever been put to sleep, or have you ever had general anesthesia? Okay, anyway, so anyway, that was about 10, 15 minutes worth of questions. He, in broken English, explained to us the process. Again, it was very, very helpful that I already knew what was going on and how that was going to happen, and a lot about the anesthesia process and surgical process and all of that. So really, we didn't have any big language barrier issues. I did find it interesting that the consent and the information about the procedures that Chayse was having, which was a total of 3 procedures, the consent for those, as well as the consent for anesthesia, as well as the literature explaining what those procedures were, all but a tiny section was in German. So that was interesting. So you would think if it were an American, non-German speaking patient that you would have to provide them with information that they could read and understand intelligently. Anyway, so we did that interview process. We went back to the same waiting room, sat out there for a little while longer. The lady from the counter came and got us and told us we needed to go downstairs and take this packet full of paperwork downstairs, and then they would talk about the admission process. So I requested that we have someone take us downstairs because I have no idea how we even got upstairs, and I can't read any of the signs because they're all in German, and my Google Translate doesn't work because we don't have service in the hospital. And quite frankly, we were tired and exasperated and stressed by that point, so I wanted someone to help us get to where we were going. And she very kindly agreed to do that. She put a little sign on the window that she'd be back in a few minutes, I assume is what it said, and down she went with us, which was very, very kind. Where she took us was right back to the ER, right back to the same window. Right back to the same window with a young lady who also did not speak English. Not broken English, just no English. So we handed her the packet. I told her what they had told us, and they sent us back to the waiting room in the emergency room. Now, by this point, we're talking probably, I have lost total track of time by now, but I'm saying 3, 4 o'clock in the afternoon. There is no room to sit in the ER. Coughing, hacking, all the things you would expect to see in an ER during cold and flu season. That's what we saw. Very different scene than when we were there at 10 o'clock in the morning. But I've already figured out in Germany, everything kind of starts around lunchtime. Wait till I tell you about the hours of admission and all that. So anyway, so we were back in the ER. Knowing that this was a patient that was going to have a surgical procedure, they wanted him to sit square in the middle of all these coughing, hacking people. I said no to that, so I put him over in the corner, over by the stairs where you leave the building. Very cool spot, quiet, and away from all the patients. And I stood over with the patients so that I could hear and see when they called him. We were there for probably 15 minutes, I'm guessing, and they called him back. We went right back to the ER, right back to the same bay that we were in. Same doctor came in. I should mention that after they gave us the results of the ultrasound, the surgeon did come in and talk to us and kind of explain. So we had an attending, and then we had a surgeon, and explain the procedures to us, answer any questions we had, all that. So that same doctor, which was also a resident, brought us back into that room again, started talking to us again about the surgery, went right back over every single thing, which I appreciate that they went over that twice with us. Every part of the procedure, every part of what to expect. Everyone across the board, the 2 doctors that we had seen to that point and the anesthesiologist all said that Chayse would be in the hospital for 7 days. He would probably have a chest tube in place after surgery for 5 days. Everybody had been very clear on that. That is different, very different than the standard of care in the States. And so I didn't say anything one way or another. I just thought, yeah, we're going to rehab him, and we're not going to stay here a week. So anyway, that is kind of brings us to the point of we're standing back there in that bay. Stacy and Cade had gotten there by that point. That was a whole mess too, because we didn't have service and we were trying to tell them where to come, and they didn't know where they were. No English writing anywhere. We didn't know. So anyway, we finally all got together in that ER bay, and that's where we stayed until the attendant came and took us up to what was going to be Chayse's floor, and then subsequently